Hello.
Hello, yeah, once again, just opening the PPT.
Okay. I have met you, the co-host. You can share the screen now.
Yeah. Hello, everyone. Welcome to Auricle Exam Mastery Live Classes, Neuroanatomy, the fourth session. So we have started this Exam Mastery Live Classes from June, and it is for a duration of about 30 days. So here we are doing rapid revision of all the important questions, quick revision of the volatile facts, as well as high-yielding topics of all the subjects will be covered here, and most expected questions in the upcoming university exams will also be covered. So this is beneficial for all the university exams of all the states. So today we will be doing some of these neuroanatomy questions. So before we go in for the class, we will see some of the core features of Auricle. So here we offer you live classes as well as recorded classes, which you can access anytime, anywhere. And we also give you CBME-based question and answer notes and MCQs. So these MCQs are from the beginner level to the expert level. So you can use the code Dr. Divya 20 for the discount on the subscription. So we have 3 subscription plans, the basic, standard, and mentorship. So basic is for 3 months, standard is 6 months, and mentorship is 12 months. And this is a wholesome program, which we offer you at a special rate of 50,000. So it includes all the features of the basic and standard, as well as here we offer you one-to-one personalized guidance as well as notes. You can use the code for the discount and subscription. You can as well book a slot for personalized counseling session on the Auricle app. So we should start with today's class. Okay. Okay, so we'll be doing the white matter of brain. Okay, so white matter of brain is a very important topic. So the central core of entire the central nervous system, like basically the brain, the brainstem and all. Here we see the gray matter towards the outside, okay, in the cerebrum, and the white matter towards the inside, okay. So this central core of this white matter, it forms the substance of the cerebrum, and basically it is composed of myelinated nerve fibers of different sizes and supporting neuroglial cells. So basically, in the white matter, see, the gray matter and the white matter, it consists of the different parts of the neuron. So gray matter will have the cell body and the dendrites as well as the supporting cells, that is neuroglial cells. Whereas in the white matter, that the axon part of the neuron is there, which is myelinated here. Okay, axons of the neurons as well as the supporting cells. Now, these fibers, we classify them into 3 types. Okay, so we classify them as commissural fibers, Okay, commissural, projection fibers, and association fibers. So when we say commissural fibers, okay, so corpus callosum. Okay, so commissural fibers, basically what happens is they connect, okay, the different parts of the hemisphere. So here, corpus callosum, okay, it connects the neocortex of the right hemisphere with the left. So here we have anterior commissure, posterior commissure, and the hippocampal commissure fibers. So anterior commissure, it connects the amygdala, okay, amygdala, olfactory bulbs, and the temporal lobes. Whereas the posterior commissure, it connects the pretectal region and the mesencephalon. Hippocampal commissure, it joins right and left hippocampus. Okay. Then we have projection fibers. So commissural fibers are basically the fibers which are connecting the different parts of the cerebral hemisphere. And projection fibers here, it is restricted to a single hemisphere. Okay, so it connects what is that, diencephalon or the brainstem region, all those things with the cerebrum. Okay, so it will be connecting on the same side. Okay, whereas commissural fibers, they connect the two cerebral hemispheres. Okay, so the components of so here examples are, for the projection fibers, we have the internal capsule. Okay, internal capsule, which is made up of like different parts, anterior limb, genu, posterior limb, retrolentiform part, and sublentiform region. So this is here the fibers which pass through, they are subdivided into corticopetal and corticofugal fibers. So which afferent fibers are known as corticopetal and efferent fibers are known as corticofugal. So these afferent fibers, what they do, they bring information from the thalamus to the cerebral cortex. Okay, so basically they are the thalamocortical fibers. Whereas corticofugal fibers, they are the efferent fibers. So from the cerebral cortex, they take the information to the, it may be to the thalamus or to the brainstem and spinal cord centers. Okay, so basically corticobulbar. Now corticobulbar is from the cerebral cortex to the medulla. Corticopontine is to the pontine nuclei. Okay, in the pons. Corticospinal to the spinal cord and corticothalamic is to the thalamus. Next, we have association fibers. Okay, association fibers means now there is two hemispheres. Now, like, the frontal lobe of one side to the sensory lobe of the same side. So basically it connects, association fibers connects two areas of the same side of the hemisphere. Okay, either in the same lobe or in the two different adjacent lobes, it will connect. Okay, so it connects the regions of the hemisphere to the regions within the same. Okay, so here we have short arcuate fibers which connects the adjacent gyri. Okay, like two gyri adjacent ones, it connects, or long arcuate fibers. Okay, so one from gyri from one lobe to the gyri of the other lobe. Okay, so commissural fibers. So these commissural fibers, as we said already, it connects the two hemispheres. Okay, right and left hemispheres. So there are four bundles, corpus callosum. So there are four here. Okay, examples for commissural fibers are corpus. Among them, the corpus callosum is a very important one. Anterior commissure fibers, posterior commissure fibers, and hippocampal commissure. Okay. So that is here we'll see. So commissural fibers, so corpus callosum, which has four regions, the rostrum, genu, body, and splenium. Okay, it connects. So if you see here, so this is the corpus callosum. Okay, corpus callosum. Here you can see the part of it. Okay, so it will be connecting the two hemisphere. Here you can see the entire portion of it. This will be the rostrum, the genu, the body, and the splenium. So these are all the association fibers. Okay, the long association, short association fibers. Whereas these are examples for, these are the projection fibers. Okay. So this is the summary. We will go for the next thing. Okay, so a 45-year-old woman presents with the progressive memory loss and confusion for the past 6 months. So see, okay, so there is progressive. So here when we say the key points, Okay, so we have it presents with progressive memory loss. Okay, there is confusion. She has also difficulty finding words and names, naming objects. So MRI shows diffuse atrophy of the temporal lobes bilaterally. So there is diffuse atrophy. Which of the following white matter tracts is most likely affected here? Okay, so here is the uncinate fibers. Uncinate fibers, cingulum, inferior longitudinal fasciculus, superior longitudinal arcuate fibers. Okay, so arcuates is cingulum, next on the same side, inferior longitudinal, superior longitudinal on the same hemisphere, it connects, okay? Whereas uncinate fibers, it connects the two sides, and arcuate fasciculus also adjacent gyrus, it connects, okay? So here the answer is uncinate fasciculus. A 32-year-old man suffers a stroke, okay, affecting the left posterior cerebral artery, okay? Left posterior cerebral artery. He develops a right homonymous hemianopia and alexia without agraphia, okay? So basically, his vision is affected, and alexia without agraphia means he has no problem with writing, okay? So which of the following white matter tract is more likely damaged? Means basically here agraphia with the motor part is okay. Okay, so here it is the inferior longitudinal fasciculus, inferior longitudinal. So if you see here, so it is the inferior longitudinal fasciculus. A 67-year-old man, he undergoes surgery for a glioma in the left frontal lobe. During the operation, the surgeon uses intraoperative stimulation to map the cortical and subcortical regions involved in the motor function. The surgeon stimulates a white matter tract that elicits contralateral hand movements. Which of the following white matter tracts is most likely stimulated in this patient? Okay. So basically contralateral. He has stimulated in one area and contralateral movements are there. He is checking. So usually it is the corticospinal tract. Okay. Corticospinal tract, which otherwise we call it as pyramidal tract, right? So that is the answer here, corticospinal. Okay. Then a 67-year-old man. Okay, this one this is done. No? So this is the explanation for the previous. Okay, left occipital lobe, whereas in the previous for the vision, no, what we were talking was responsible for visual processing, and it is disconnected from the left temporal lobe, responsible for language comprehension. Okay, so that is why there was no agraphia and all those things. Okay. So the corticospinal tract is a projection tract that originates from the primary motor area and descends through the internal capsule, brainstem, and spinal cord. So it is responsible for the voluntary control of the contralateral limb and trunk. So it can cause spastic hemiparesis. So damage to the tract, corticospinal spastic hemiparesis, hyperreflexia, and Babinski's sign will be positive. Which of the following is the largest commissural fiber that connects the two cerebral hemispheres? Okay, so the answer is corpus callosum. So anterior commissure, posterior commissure, they connect the anterior posterior portions. Okay, so that is they are shorter, whereas corpus callosum connects entire one hemisphere with the other. So the corpus callosum is the largest and most important commissural fiber that connects the corresponding regions of the two cerebral hemispheres. So it consists of 4 parts: rostrum, genu, body, and splenium. Okay. So it integrates the sensory, motor, and cognitive functions between the two cerebral hemispheres. Next is blood supply of brain. So blood supply of brain, when we say vertebral, so we need to understand the branches of which arteries will supply the brain. Okay. So vertebral arteries. So vertebral arteries, basically the branches of which will supply the brainstem as well as the spinal cord and pons. Okay. So we'll see the origin and the course. So the origin, it is a branch of the subclavian artery. Okay. It's a branch of subclavian. So from the then the first part, so this course of this vertebral artery we divide into 4 parts. So the first part is from the origin to the foramen transversarium of the 6th cervical vertebrae. Okay, so from the origin to foramen transversarium. So that is why in the 7th cervical vertebrae, we do not see the foramen transversarium, because foramen transversarium is mainly for the passage of the vertebral artery. The second part here, it is from the foramen transversarium of the 6th to the foramen transversarium of the 1st cervical vertebrae. That is the second part. Third part is from the posterior arch of the atlas, okay, vertebrae in the suboccipital region. So that is the third part. So the third part is seen in the suboccipital region. Okay, third part in the suboccipital region. And fourth part, it enters the cranium to the foramen magnum. So what we see in the cranial cavity is the fourth part. So here, how does it enter? It pierces the dura mater and the arachnoid matter, enters the subarachnoid space. Okay, then it rounds around, it will go around the ventrolateral aspect of the medulla oblongata. So at the lower border of pons, it will join with the opposite vertebral. So there are two vertebral, no, right and left vertebral arteries. They join to form the basilar artery. So you can see here, this is the vertebral artery. So this is the origin to here. It is the first part. This entire thing is the second part. In the suboccipital region here, where it appears near the posterior arch of the atlas, is the third part, and inside will be the fourth part. So this fourth part joins to form the basilar artery here. Okay. So within the cranial cavity, it gives posterior spinal artery, posterior inferior cerebellar artery, and anterior spinal artery. Okay. So posterior spinal artery is the first intracranial branch, supplies the spinal cord, medulla. Okay, among the spinal cord and the medulla it supplies. Posterior inferior cerebellar artery, it is the largest branch. It supplies the lateral portion of the medulla. Okay, lower border of the pons, and it reaches the posterior aspect between the fourth ventricle and cerebellum. So it also gives branches, okay, to the cerebellum. It supplies there, and also gives the choroidal branches for the fourth ventricle. Then anterior spinal artery, here it is a pair, okay, it is formed by the union of branches from each of the vertebrae. So there are a pair of anterior. Posterior spinal artery is single, whereas anterior spinal artery is in pairs. It supplies the median part of the medulla oblongata and descends inferiorly through the length of the spinal cord. Okay, so it is in the anterior sulcus. Okay, anterolateral sulcus, it will run and it will be supplying the, I'm sorry. So anterior spinal artery, it is a single, it runs in the median, whereas the posterior spinal artery, they are in pairs. Okay, posterior spinal artery runs in pairs in the posterior lateral sulcus, whereas the anterior spinal artery is formed by the union from one branch from each spinal artery it gives, and that spinal artery joins together to form the anterior spinal artery, which runs in the anterior median fissure. Next is basilar artery. So these are all the arteries which are basically the branches of which will be supplying the cranial cavity. Okay, so you just need to know which are those arteries and what branches they give. So basilar artery origin is, it is formed by the union of two vertebral arteries. Okay, so near the pontomedullary junction, there is a groove. So there it joins to form the basilar artery, and these vertebral arteries are originating from the subclavian already. Know that, okay? So these two vertebral arteries, they will converge near the lower border of pons to form the basilar artery. So what are the branches of basilar artery? It gives anterior inferior cerebellar artery, anterior inferior. Posterior inferior cerebellar was given by vertebral. So anterior inferior cerebellar artery, labyrinthine artery, pontine branches, superior cerebellar artery, and terminal posterior cerebral artery. It gives, okay? So anterior inferior cerebellar artery, it arises at the lower border of the pons, and it supplies the 6th, 7th, and 8th cranial nerves and anterior-inferior aspect of that. As the name says, anterior-inferior. So it supplies the anterior-inferior aspect of the cerebellum. Labyrinthine, this one, it accompanies the vestibulocochlear nerve. Okay, so it enters the internal auditory meatus to supply the internal ear. Pontine branches, they are slender branches piercing the pons in the medulla and the in the medial and the lateral parts of the pons. It pierces and supplies the pons. Then superior cerebellar artery. Superior cerebellar artery, it arises close to the superior border of the pons, runs posteriorly along the superior border of the pons and middle cerebellar peduncle. So basically, it will be supplying there, supplies the cerebellum as well as the adjacent parts of pons and medulla. Then two terminal posterior cerebral arteries, they diverge at the upper border of pons. Okay, so here they diverge posterior cerebral and they give rise to the central or posteromedial group branches. Okay, near the midbrain. Okay, so which are those posterior branches of the posterior cerebral arteries? So posteromedial central branches are, they pierce the ventral surface of the base of the brain, form the posterior perforated substance in the interpeduncular fossa, that is in the anterior part, near the base of the brain, you will see it. It supplies the midbrain and caudal part of the diencephalon. Then it also gives posterior choroidal artery. So it arises on the lateral aspect of the central branches and supplies the choroid plexus. Okay, supplies the choroid plexus of the lateral ventricle and third ventricle. Cortical branches, this give for the cortex, basically temporal branches, parieto-occipital branch and occipital branch to the cerebral cortex. All these branches go to the cerebral cortex. Then the third artery which supplies the brain is the internal carotid artery. Okay, so it enters the cranial cavity after passing through the carotid canal. Okay, then it and the superior aspect, so it doesn't pass through foramen lacerum, but in relation to foramen lacerum, it passes. Okay, and it passes through the cavernous sinus, piercing the dural. So it passes through, and then it pierces the roof of the cavernous sinus. So the entire course. Okay, so entire course. So when it enters, it enters something like this, and then it passes through the roof, and then again it pierces and comes out like this. Okay, so it is something like a siphon. Okay, so that is known as the carotid siphon, the course of the internal carotid artery within the cavernous sinus. No, it's called as the carotid siphon. So it is related here laterally to the optic chiasma, and inferior-laterally there is anterior perforated substance which divides in medial and it divides, okay, into medial and anterior cerebral arteries. So the branches it gives are ophthalmic artery, posterior communicating artery, which gives branches to crus cerebri, optic tract, hypophysis, hypothalamus. Then there is anterior choroidal artery, which supplies the crus cerebri. So crus cerebri and all, they are parts of the midbrain, okay? And choroid plexus of the inferior horn of the lateral ventricle. Anterior cerebral artery it gives, which is the terminal branch of the internal carotid artery. So deep branches of anterior cerebral artery, it supplies part of the internal capsule and the basal nuclei. So cortical branches, they supply the medial surface of the hemisphere by giving orbital, frontal and parietal branches. Then there is middle cerebral. Okay, so this is anterior cerebral. So this is the course I told you, which is called as the carotid siphon. So terminal, it divides into anterior and middle cerebral. So middle cerebral here, It is the largest terminal branch of the internal carotid. It gives deep or perforating branches which supply the anterior limb of the internal capsule and part of the basal nuclei. It ends by giving cortical branches to temporal, frontal, and parietal lobes. Next is circle of Willis. Okay, circle of Willis is there. So individually, circle of Willis can be asked as a short essay or a short answer question. So circle of Willis, what is this? First is the definition. So it is an hexagonal arterial circle. Okay, it's an hexagonal. So you will see it's something like the hexagonal arterial cycle. Okay, so 6 sides. So hexagonal arterial cycle, which is seen at the base of the brain. Okay, so the location is at the base of the brain at the interpeduncular fossa. So how is it formed? It is formed by the anterior cerebral branches, terminal parts. Okay, branches or anterior cerebral artery branches, terminal parts of internal carotid artery with the posterior communicating branch and posterior cerebral branches of basilar. So we have to see where what branches are there. Okay. So anterior cerebral arteries. So in anteriorly, no. So here, if you see, this is the anterior communicating artery. Okay. So anteriorly, there is anterior communicating artery, which will be joining the two. So these two are the these are the anterior cerebral arteries. Okay. So anterior cerebral arteries, this artery and this artery. So if you see anteriorly, there is anterior communicating artery. This is the anterior communicating, which joins to anterior cerebral arteries. Then anterolaterally, so this is the anterolaterally, there are two anterior cerebral arteries. Laterally, there is internal carotid artery. Okay, laterally internal carotid artery is there. And posterolaterally, okay, there are posterior communicating arteries. And posteriorly, there is posterior cerebral artery. Okay, so this is the circle of Willis. Okay, so circle of Willis, basically here, if you see, there are two different blood vessels, basically the branches of internal carotid and branches of basilar artery, they form. Okay, so the blood which is flowing there will be flowing in two different pressure. Okay, they don't mix. Only when there is a what is that? If there is a lesion somewhere, okay, and the blood supply is compromised in that lesion, then this circle of Willis becomes patent. Otherwise, the blood will be flowing in their own direction there without crossing over. Okay, only when there is a lesion, it needs to, it becomes patent. So when we say branches, now what do we mean by these branches is cortical, central, choroidal. Okay, so these branches, okay, so these are the branches from the different arteries, whatever are supplying the brain. Okay, so basically those arteries will give three types of branches. That is cortical, central, and choroidal. So it may be the branches of what is that internal carotid or basilar artery. Okay, so they give cortical, central, and choroidal. So what do we mean by cortical branches? So these cortical branches, as the name says, it is for the cortex. Okay, so they are arising from, that is cerebral cortex. When we say cortex, we talk about cerebral cortex. So they arise from the anterior cerebral, middle cerebral, and posterior cerebral arteries. Okay, anterior, middle, and posterior cerebral arteries. So anterior and middle are coming from which one? They are coming from the internal carotid artery, whereas posterior cerebral artery is coming from the basilar. Okay, so they are the cortical branches. Then central branches. Central branches, okay. So cortical branches, when they supply basically, the cortex of the cortex means the gray matter, the gray matter part. So they supply that part. So central branches. So central branches arise in 6 groups. Okay, so we have anteromedial group from the anterior cerebral and anterior communicating arteries. So anteromedial group is coming from anterior cerebral and anterior communicating. Anterolateral group is coming from middle cerebral. Okay, anterolateral group is from middle cerebral. Posteromedial. So anteromedial group, anterolateral group. Posteromedial and posterolateral. Okay. So posteromedial group will come from posterior communicating and posterior cerebral. Posterior lateral group is coming from the lateral parts of each posterior cerebral artery. Okay, so these are the central. Those, so they will be supplying the white matter part. Then we have the choroidal branches. Choroidal branches, we have anterior choroidal, posterior choroidal, and posterior inferior cerebellar artery. So choroidal branches, when we say, they basically form the plexus to supply the ventricles. Okay, so anterior choroidal, so branch of the internal carotid, so branch, anterior choroidal artery, branch from the internal carotid. It supplies the choroid plexus of the inferior horn of lateral ventricle. Posterior choroidal coming from the posterior cerebral artery, okay, which is coming from basilar artery. It supplies the choroid plexus of the remaining portion of the lateral ventricle as well as the third ventricle. And posterior inferior cerebellar artery, it supplies the choroid plexus of fourth ventricle. Okay. So anterior choroidal was coming from internal carotid, posterior choroidal from posterior cerebral, which is a branch of basilar. Posterior inferior cerebral artery is coming from the vertebral. Okay. So arterial supply of different areas of the brain now. So cerebral cortex, okay, is supplied by branches from all the 3 arteries. Okay, so all the 3 means, vertebral, basilar, internal carotid. So superolateral, near all the 3 arteries here, okay, basically it gives off from each part. No, we have the anterior, middle, and posterior cerebral arteries. So they supply. So the superolateral, now this is the superolateral surface. Here, the main artery which supplies will be the middle cerebral. Okay, middle cerebral. And the areas which are not supplied by middle cerebral on this surface is this one. This is the 2 centimeter wide area along the superomedial border, which extends from the frontal lobe to the parieto-occipital sulcus. Okay, so this portion is supplied by anterior cerebral. Then we have this portion, that is the occipital lobe. The is supplied by the posterior cerebral and the inferior temporal gyrus. Okay, inferior temporal gyrus, which is supplied by the posterior cerebral artery. So both this occipital as well as the inferior temporal gyrus are supplied by the posterior cerebral artery. Rest mainly the superolateral surface is by the middle cerebral artery. Then the medial, here the tentorial surface. So here it is, medial surface is not shown here. So medial, now this is the inferior surface. So medial surface is basically anterior cerebral artery. Okay. So the medial aspects of occipital lobe, temporal lobe, except around the temporal pole is supplied by the posterior cerebral. Because if you see here, temporal pole is supplied by the middle cerebral. Okay. Then inferior surface here, the medial 1/3 of orbital surface here, it is the anterior cerebral artery. Lateral 2/3 is middle cerebral artery. Rest of this tentorial surface is posterior cerebral artery. Okay, so mainly when we say among the surfaces, the superolateral surface, the main artery is middle cerebral, and medial surface, the main artery is anterior cerebral, and inferior surface, main artery is posterior cerebral. Okay. Then cerebellum. The cerebellum, otherwise called as the little brain, is supplied by superior cerebellar, anterior inferior cerebellar, and posterior inferior cerebellar arteries. Okay. Then veins. So here, the veins of the brain, they have characteristic feature. One is The walls, they do not have muscles. Okay, so blood vessel, we know, has got 3 layers, no? So it has a muscular layer also. So here they do not have that muscular layer. The veins have, they do not have valves like what we see it in the other parts of the body. And to maintain the patency, okay? So to maintain the patency, instead of opening directly, okay? So if the dural venous sinuses are there, because these, they open into the venous sinuses, they will run obliquely, okay? So if it is straight, what happens? Because of the pressure difference, it can collapse. So when it runs obliquely, the blood flow is regulated there, okay? And sorry. Okay, so and the patency is maintained. So now these veins, we group them into external cerebral veins. So external cerebral veins, when we say, it includes the superior cerebral vein, superficial middle cerebral vein, deep middle cerebral vein, inferior cerebral veins, and anterior cerebral veins. Okay, so superior cerebral veins, now they are about 6 to 12. So superior, superficial middle cerebral, deep middle cerebral, inferior cerebral, and anterior cerebral veins. So superior cerebral veins, they are about 6 to 12 in number. So they drain mainly the superior lateral surface of the hemisphere. Okay, so the superior cerebral veins, we have the superior lateral surface. And they will end up, okay, so superior lateral surface, and up along the superior lateral surface, that border, we have the superior sagittal sinus, right? So they terminate in the superior sagittal sinus. Then superficial middle cerebral vein, it drains around the posterior ramus of the lateral sulcus, okay, posterior ramus of lateral sulcus, and it terminates in the cavernous sinus. So closer to that will be the cavernous sinus. So it either terminates in the cavernous sinus or sometimes into the sphenoparietal sinus. Okay, so it drains into this by the superior and inferior anastomotic veins. So through this veins, it drains into these sinuses. So it also through these superior and inferior anastomotic veins, okay, it actually communicates with the superior sagittal and the transverse sinus. It also communicates with the middle cerebral vein. This is around here. So with the superior and inferior anastomotic veins, it will communicate with the superior sagittal and transverse sinuses. Then we have deep, this superficial will also communicate with the deep middle cerebral vein. Now, deep middle cerebral vein, it drains the surface of insula and terminates in the basal vein. Now, what is insula now? If you recollect, insula is the hidden lobe, isn't it? We call it as the fifth lobe of the brain, fifth lobe of the brain. Okay, so it is a hidden lobe. Inferior cerebral veins, we divide them into orbital and tentorial veins. The orbital veins terminate in the superior cerebral veins or superior sagittal sinus. Tentorial veins drain into the cavernous or any other sinuses in that region. So anterior cerebral veins, they are small veins and they drain the corpus callosum as well as the anterior part of medial surface of the hemisphere. So it terminates again in the basal vein. Okay. So outside here, we have all the sinuses. These are the sinuses and these are the veins. Now, internal cerebral. So that was about the external cerebral veins. Now, internal cerebral veins. It is formed by the union of thalamostriate and choroidal veins at the apex of the tila choroidea of the third ventricle. Okay. So here, near the apex of the third ventricle, it is formed by the at the apex of the tila choroidea of the third ventricle. It is formed by the union of thalamostriate and choroidal veins. So they are right and left veins. They run posteriorly, parallel to each other in the tila choroidea. Okay, tila choroidea, they will be running parallel to each other, and they unite together to form the great cerebral vein below the splenium of the corpus callosum. So, okay, so splenium will be somewhere here. From here, the great cerebral veins. You can see here, there is the great cerebral vein which will form. Okay. Next is great cerebral vein of Galen. So this is usually a commonly asked short answer question. So great cerebral vein here, it is a single median vein. Okay, so it is seen in the center, median vein, formed by the union of two internal cerebral veins. So where does it terminate? It terminates in the straight sinus. Now, where is this straight sinus? At the junction of the falx cerebri with the tentorium cerebelli. In that fold, we see the straight sinus, right? So it drains into the straight sinus. And what are the other tributaries which will join the great cerebral vein of Galen? Basal veins, veins from the pineal body, from the colliculi, the cerebellum, and adjoining part of the occipital lobes of the cerebrum. So they all drain into this great cerebral vein. Basal vein. So basal vein is again a commonly asked question. So there is one vein on each side. It is formed near the anterior perforated substance by the union of deep middle cerebral, anterior cerebral, and striate veins. So these, okay. SAD, you remember SAD, okay. SAD, SAD. So S is for striate veins, A is for anterior cerebral, and D is for deep middle cerebral. So all of them join to form the basal. SAD basal. Okay. So posteriorly, it is cerebral peduncle. It terminates by joining the great cerebral vein. Again, basal vein is one of the tributary, right? So it terminates by joining the great cerebral vein. So to the basal vein, the tributaries include small veins from the cerebral peduncle, interpeduncular structures, tectum of the midbrain, and parahippocampal gyrus. Next, coming to the blood supply of the brainstem. So midbrain is supplied by branches from the posterior cerebral artery, including central branches, both posteromedial and posterolateral. Pons is supplied by pontine branches of basilar artery. Medulla is supplied by the medullary branches of vertebral artery, branches from the posterior inferior cerebral artery, as well as veins from the brainstem draining into the neighboring venous sinuses. Okay, so the veins of the brainstem, basically, they drain into the neighboring venous sinuses. So basically, in the posterior cranial fossa, there are many venous sinuses there. So it drains there, okay. So hypertensive patient, age 60 years, was taking treatment, okay. Very erratically, means was not regular with this treatment. And one night he felt severe headache and soon paralysis of both his right side limbs. Okay, so both the upper limb and lower limb, there was paralysis. So here basically what has happened, stroke has happened. Okay, so what do we mean by that, stroke? So basically, stroke can be either ischemic or hemorrhagic. Okay, so ischemic, as the name says, the blood supply is hindered to a part of the brain. The blood supply is hindered, just like how in the heart, the blood supply is hindered, right? So it can happen because of a blockage in the artery. Hemorrhage can occur when the pressure in the artery increases, especially in the intracranial cavity. Pressure can rise, especially as an hypertensive patient, pressure can rise and the blood vessel may burst. Okay, so that results in hemorrhage. And both of this will cause paralysis, that is hemiplegia. Labyrinthine artery is a branch of which one? Basilar vertebral internal carotid posterior inferior cerebellar. So it is basilar. Vein of Galen or great cerebral vein is formed by the union of right and left internal cerebral veins. That is the answer. Which of the following arteries supply the visual fibers? Visual fibers is basically occipital lobe. So it is the middle and posterior cerebral. Anterior spinal artery is a branch of vertebral, internal carotid, basilar or labyrinth. So anterior spinal artery is branched from the vertebral. Okay, so coming to the meninges of the brain. So the brain is a vital organ. So brain, basically, it's a vital organ present within the cranial cavity, of course. Okay, but along with the cranial cavity, it is also the protection is provided by the meninges. Okay, meninges. So meninges, we have the dura mater, the middle arachnoid matter, and the inner pia mater. Okay. So there are three spaces. So there are three spaces in relation to the meninges. Okay. So outside the dura mater, we call it as the extradural space. Okay. Below the dura mater, there is subdural, and below the arachnoid mater, there is subarachnoid space. So you should know what these each spaces will have. Okay. So cerebrospinal fluid mainly is present in the subarachnoid space. So this cerebrospinal fluid, it acts like a cushion. Okay. And the dura mater here, okay, so the dura mater in the cranial cavity, you have to remember, has got two layers, endosteal layer and the meningeal layer. So between this endosteal and the meningeal layer, there will be these venous sinuses are present, okay. So explain the role and this structure of the meningeal layer in protecting the brain. So as I said, there are three layers, and dura mater, that is dura, arachnoid, and the pia mater. So dura mater, it comprises the outer endosteal and inner meningeal layer. So endosteal, as the name says, it will be lining the entire cranial cavity inside. Okay. And it forms the folds. So this dura mater will form the folds, which we call it as the dural folds. So dural folds will be enclosing the venous sinuses. Then we have arachnoid matter. Arachnoid matter is thin transparent membrane which surrounds the brain, bridging the irregularities. So it enters the sulci and fissures, okay, with prolongations, providing sheath for the cranial nerves. Arachnoid villi. Okay, so from this arachnoid matter, there are arachnoid villi or arachnoid granulations which will project. Okay, if that is, it will. If it will basically drain, it will project into the venous sinuses and it will be draining the excess of CSF. Okay, absorbs. Okay, so these arachnoid villi, when they enlarge, we call it as the granulations. So as age advances, they will enlarge and form arachnoid granulations. Then pia mater, it is a closely adherent layer to the brain. Okay, investing the brain. It forms folds in relation to the fissures. So wherever the fissures are there, it will also form the folds there. Okay, it comprises the epipia and pia glial pierced by blood vessels nourishing the brain, and the it has the epipia and the pia glial. Okay, so it is pierced by blood vessels which nourishes the brain and the spinal cord. So prolongations, it provides. So its prolongations, they provide sheath for the cranial nerves and also forms perivascular sheath for the vessels. That is the blood vessels there. Then extradural or subdural space. Now extradural space, it is outside the, as the name says, extradural. So outside the dura mater. Okay. So it is the space present between the skull bone and the endosteal layer of the dura mater. So this subdural space is as a name below this dura mater, okay, subdural space. So it is a potential space between the dura and the arachnoid matter, which is traversed by the cerebral veins. Subarachnoid space is between the arachnoid and the pia mater, which is traversed by arachnoid trabeculae. Okay, so in the subarachnoid space, there is CSF, large blood vessels, and serves as a passage for the cranial nerves too. So Virchow-Robin perivascular spaces separate subarachnoid space and perivascular spaces. Okay, so dura mater, outer endosteal and encloses the venous sinuses and it forms the folds dividing the cranial cavity. So function, it provides structural support and okay, and it forms the folds, isn't it? Folds, and it will. Why do we have the dural folds within the cranial cavity? It could have been a single covering, but in the cranial cavity, the brain, we have like two hemispheres and all those things, right? The cerebellum is there, and there are three different foci in the cranial cavity, anterior, middle, and posterior, which are at different levels. Okay, so what happens is, if it was a single covering, we move our head, except when we are resting. Rest of the time, we move our head frequently, consciously or subconsciously. We keep moving our head when we speak, when we talk, when we move about. The head keeps moving, right? So during the movements of the head, there should not be any the brain which is present within the cranial cavity should not move. There should not be movements along with the movements of the head. Okay, so to keep it in place, we have these folds. Okay, so because the folds contains the sinuses, it is important to understand the intracranial pressure. Arachnoid matter, it is a thin transparent membrane, bridges all the brain irregularities entering the sulci gyri. Okay, and it also covers the nerves. So it forms a protective barrier, and arachnoid villi, they absorb the CSF and they drain it into the venous sinuses. So as it advances, this villi become granulations. Okay, so basically here, CSF, eating back. So in case if it doesn't absorb, so if there is so whatever excess is formed is drained. But if there is any defective drainage and all, it can result in hydrocephalus. Pia matter is a thin vascular membrane which closely invests the brain. Okay, it consists of epipia and pia glyph. It forms the folds, okay, within as the brain tissue is, and it nourishes the brain with the blood vessels, provides sheath for the nerves. It is essential for blood supply and vital in surgical procedures. Extradural and epidural space, already said, potential space between the skull bone and the endosteal layer. So when we say epidural space, that is the space where they give the epidural anesthesia. Okay, because that part only the nerve emerges from the thing, and then we give it in that part. Okay, so it acts as a buffer and potential space for intervention. It is important in anesthesia and certain medical procedures. Subdural space is a potential space between the dura and the arachnoid matter, and it is traversed by the cerebral veins. So it allows for the fluid dynamics and can be implicated in pathology. Means subdural space below the dura mater, right? So here there are actually venous plexus. Okay, so capillary venous plexus are there. So it can result in heavy bleeding. Yeah. Okay. So especially in trauma, subdural hematoma is more common. And subarachnoid space, it is a space between the arachnoid and the pia mater. It contains CSF vessels and the arachnoid trabeculae. So here basically the CSF is present and it facilitates for the nutrient exchange. Cranial nerves, they pass through this space. Okay. It is significant. So subarachnoid space, since it contains the CSF, okay, so it needs to be maintained there. Okay, per minute about 150 ml of the cerebrospinal fluid will be circulating, okay, to the brain. Next is subarachnoid systems. Okay, so this is important, subarachnoid systems. So we have cerebellomedullary system and cisterna pontis. So this is a cerebellomedullary system, right? So it is the angle between the medulla oblongata, cerebellum, and the occipital bone. Okay, so there at that point, what happens is that space, okay, the subarachnoid space, what is there, it becomes little wider. So that is why we call it as the cistern. Cistern means like, you know, that big vessel where in the earlier times they used to heat water and all, okay, for bath and all, that big vessels, we call it as the cistern. So it contains, okay, in the cerebellomedullary system, we have the vertebral artery, okay, origin of the posterior inferior cerebellar artery, and the cranial nerves, the last four cranial nerves, okay, because it is at the angle of the medulla, right? Medulla oblongata, cerebellum, and occipital bone. So it receives CSF, provides space for the vessels and nerves, and it reinforces protection, okay, of CSF in the vital centers. Then there is cisterna pontis. Pontis, in relation to the pons, in the ventral aspect, there is a one more wider space. This cisterna magna is important. Other cistern, smaller, is interpeduncular cistern across the two temporal lobes. Cistern of the lateral sulcus, that is front of each temporal pole. Cistern of great cerebral vein, which is also called as cistern ambiens. It is between the splenium of the corpus callosum and the superior surface of cerebellum. Lumbar cistern, okay, lumbar cistern. It is in the lumbar region of the vertebral column between L3 and L4, where the spinal cord ends. Okay, so since the spinal cord ends there, suddenly that space there becomes bigger. Okay, because there is no spinal cord down below that, and that's why. So communications here, that is medial foramina of Magendie with the lateral foramina of Lashkar. Okay, prolongations, that is it prolongates the arachnoid matter into arachnoid sheath along the nerves, and it extends along the ear sheath. Okay. So with this, we end today's class. So thank you for watching Auricle. For more content, you can follow our social media handles, that is on YouTube, Instagram, Facebook, and Telegram. And for those who haven't yet downloaded the app, you can get it on Google Play and App Store, and you can start the journey with Auricle. So until then, next time.